Hello everyone, welcome to Angela Anatomy Classroom. So today we are going to study about the radius bone. What is radius bone? Radius bone, see in forearm we have two bones, radius and ulna. So the bone located on the lateral side of the forearm is the radius. Okay, so this radius is homologous to the tibia of the lower bone. So let's discuss about the features of the radius bone. First is, it has three main parts: the upper end, shaft, and the lower end. So the upper end, you can see in the diagram as well, upper end, shaft, and lower end. This is the radius bone. So let's talk about the upper end first. Upper end consists of three main parts: head, neck, and tuberosity. Okay. The shaft consists of borders, anterior, posterior, medial, and surfaces, anterior, posterior, and lateral. Lower end consists of around 5 surfaces: anterior, posterior, medial, lateral, and inferior. So just not wasting the time and coming to the upper end again, we have, first of all, we have head here. The head is disc shape. It is concave. Superior surface is concave, which articulates with the capitulum of the humerus at elbow joint. Circumference of head fits into socket formed by the radial notch of the ulna, forming the superior radio-ulnar joint. That means the head participates in the formation of superior radio-ulnar joint. This, see, you can see the joint here. This is, radius. Okay. So the head of the radius is joined to ulna. That is what it is written here, that the head fits into the radial notch of the ulna. Okay, you can see here, head fits into the radial notch of the ulna. On the other hand, its superior concave surface, on one hand it attaches to the radial notch of the ulna, and on the other hand the superior concave surface, see, this surface articulates with the, this superior surface articulates with the capitulum of the humerus at the elbow joint. Okay. So head participates in two joints, one forming with the ulna and other forming with the humerus, radio-ulnar joint and elbow joint respectively. The key points you have to remember about head is, it is disc shape. Okay. Superior concave surface, superior radio-ulnar joint. That means its superior concave surface, as I already told, participates in the formation of elbow joint with the capitulum of the humerus, and another, on the other hand, it fits into the it fits into the radial notch of the ulna, forming the superior radio-ulnar joint. Okay, so this was all about the head. Now coming to the neck. Neck is another important part of the upper end. Okay, it is the constricted part below the head. It is the constricted part below the head. It is also surrounded by the lower part of the annular ligament. Radial tuberosity lies just below the medial part of the neck. Okay. So you can see here, radial tuberosity lies just below the medial part of the neck, where the neck ends From there radial tuberosity starts. Okay, it is surrounded by lower part of the annular ligament. And how will you locate it? What is neck? The constricted part. See, this is more clear from this diagram. Okay, the constricted part just below the head is the neck. Okay, now coming to the shaft. See, a shaft has, as I already told you here when I was telling you about the parts, the shaft consists of borders and surfaces. Okay, so how many borders we have here in the shaft? Anterior border, posterior border and interosseous border. So first of all we would be studying about the anterior border. Anterior border extends from the anterolateral side of the radial tuberosity and moves obliquely downwards to the lateral side. It is more defined in its upper and lower parts. See, you can see in the diagram, it starts, let's focus on the diagram. It starts from the lateral side of the radial tuberosity and moves obliquely, okay, downwards to the lateral side. It is moving